Hi, team. My name is Christina Creer, and this is my Caritas process for number 3. This is for the class Foundations of a Caring Science. Today is December 14, 2020. So today, what I would like to go over with you, my objectives, is Jean Watson's nursing theory, the meaning of Caritas, the 10 Caritas, Caritas and the Caring Science, and the Caritas that I chose, number 3, and Caritas and what it means to nursing. So Jean Watson, a nursing theorist, some of the background for Caritas is that she believed that the human being was connected directly to caring and to love. And one of her quotes says, "Maybe this one moment with this one person is the very reason we're here on earth at this time." And that's from Jean Watson, the nursing theorist. So as we move forward, we find out that Jean Watson established her nursing theory somewhere between 1975 and 1979. In the research that I did, it leans more towards 1979 that the theory was actually established and denoted to be a grand theory. Grand theories are said to be more abstract. They're not so concrete. So it's not something that we can necessarily make tangible, if you will. It does provoke thinking, and it gives room for different perspectives. But it's not something that we can actually just, grasp the concept as a concrete object. And it makes it more difficult just to understand sometimes. The main premise of Watson's nursing theory was to promote health and prevent illness. These ideas of promoting health were through, again, caring and being in touch with the intangible that all of us possess as human beings. So there's a total of 10 Caritas, and in these Caritas, obviously you see it's pretty wordy. However, some of the words that stuck out to me were love, kindness, being present with your patient, whether it was spiritually, some type of support that you are giving them to establish or to assist with the healing practice. Also, as healthcare providers, we were teaching as well as learning, and we were assisting patients to their optimal level of comfort and allowing them to have dignity and peace. And we were accepting of their ideas. Some people may believe in miracles. And even though as a healthcare provider, you may not necessarily believe in a miracle because you've seen the clinical data that may suggest something different. However, as part of the Caritas and the caring theory from Jean Watson, it was important for us to be able to embrace the ideas of other people, even if we didn't have the same beliefs. So after seeing the wordy version of the Caritas, some of the simple definitions that I found online, love of humankind, charity, virtue, these things allowed us to flourish and to have peace and to give dignity or to practice with dignity so that we could establish a sense of well-being and a sense of health and a sense of justice in our practice. So the Caritas that I chose was the third one, and this one says to trust self and others by nurturing individual beliefs, personal growths, and practices. And so I found this quote online. It says, if you want to trust other people, you must first learn how to trust yourself with other people. And I found that quote to be interesting because it talks about the reciprocity of trust, one that we must go into with an open mind and wanting to believe in our patients and what they say and be subjective as well as observant of the things that we see. So again, Caritas number 3 is to trust self and others by nurturing. And I think part of that nurturing is kind of an innate ability for us to do as healthcare providers. I think it's something that is easier for some than others for us to be nurturing and caring and to display that type of behavior. Some of us were raised in a household where those nurturing behaviors were second natures, where some of us may have had to learn them as we go along. Or the older we got, where we just learned the behavior and we thought it was an acceptable behavior and we adapted to it. And those things then stemmed into our personal growth and thus into our practices. The next slide you're going to see talks about trust in the nursing process. And so from the very beginning, Nursing 101, we're taught the nursing assessment, the head to toe, and how we communicate those findings to our patients. And so, again, the nursing process will consist of objective and subjective data. And again, that leads into our caring, because some of the data, like we're taught, pain is the fifth vital sign. And whatever the patient says the pain level is, we have to believe it. And so that leads into that reciprocity of the trust, the one that we know we have to trust ourselves, that we are assessing them properly and our findings are accurate, and also what they're telling us is the truth. We have to care enough, according to Jean Watson, to make sure that the patient understands what our plan is, how we're going to provide the interventions for their care, and what our ultimate goal is. Like they say, discharge begins upon admission. So we have to believe that what we're finding is accurate, and that the plan that our other disciplines, doctors, respiratory therapists, whoever it is, that their interventions are accurate also. You also want to ask the patient for their input, because it's important for the patient to feel that they are part of their plan of care and that we are trusting them and what they feel to be important or a priority, and that we are making a point of addressing their concerns as well. And so just to make it simple, the reveal and listen allows us to understand. And that's not just us, but it's also the patient as well. So, if we're just going in asking question after question after question, it can seem a bit interrogating. However, if we're willing to reveal parts of ourselves and what we're trying to do, we're then revealing, we're sharing, we're also being transparent about our intentions. And the patient is listening, we're confirming that they're understanding what we're trying to reveal. And then you have, again, that mutual respect, and you have the mutual understanding that needs to happen in order to have a caring and healing environment. So as we continue with our science of caring, we establish the mutual respect, and we recognize core values, things that are important to us to practice at a certain standard, and things that are important to the patient for them to feel like they're being heard and recognized as not just a number or not just a body in a bed, but also as a human being who deserves to be heard, and that we are listening to them. Another part of the third Caritas is for the acceptance and the cultural acceptance. And so it is important to acknowledge not just the similarities that make us one and the same, but also our differences that make us so unique and so special. And you'll find that when we acknowledge these differences, it can provide a level of comfort for the patient. It gives them a sense of respect, whether the differences are how they choose to form a sentence, whether the difference is their religious background. And then some of the similarities that I thought were communication styles. Sometimes when we're in pain, we may all grimace, we may all groan. Another similarity is that for the most part, we all care about our families. And so when you have those worried family members who are calling in, who might not be so nice, I think it's important to recognize this is not personal, because we are to maintain professionalism over personality at all times, and to not be judgmental, and to recognize that we all care about our families, maybe in different ways, but for the same reason, because they're important to us. And lastly, the personal growth that happens that the third Caritas talks about, it stems from acknowledging and understanding different perspectives. Not necessarily that we agree with them. However, we do acknowledge that they exist, and we do recognize what type of mindset we have. Are we stuck in our only way of thinking, or are we able to embrace another mindset that allows us to better care for our patients. This allowance that we see from different perspectives gives us insight and it gives us understanding. And I think that once we have a better understanding of where people are and we can meet them there, we can better serve our population. Thank you guys for your time. I appreciate you watching, and I hope everyone has a good night.